People are getting pets as a status symbol. It's not like you're getting a car or you're getting a. Having a pet is a commitment. It's just like having a baby. Yeah, if you are not committed to it, please don't do it.
Don't you think that there should be some strict laws?
Nobody talks about the mental health of pets. It's not a human. Depression in veterinary professionals is a real thing. So, the dry FIP is actually bad form I can see from corona. 70 to 80% of Dubai cats, if you check for corona, they have corona. The food allergy is very, very common. You don't have to medicate them. I am an internal medicine specialist. My cat doesn't go out. She's inside. Why do I need deworming? I have a cat. I can't have lilies in the house. It's toxic.
My cat is not using litter box because of UTI or something.
They will not use a litter box that is not cleaned. You need to clean your litter box every day. They jump all over the house and everything. They don't need a walk and they use litter box for their business.
Sign of life-threatening.
The dog is choking if he's not breathing. The dog is swollen and it can be like life-threatening.
Okay, so there is a very common question. How often should I bath my dog? Did you know 70% of pet parents unknowingly make mistakes that harm their pets? Welcome to Let's Off Leash, the podcast where we dive into the world of pet care with experts who know it best. Today, we are thrilled to have Miss if I'm not wrong, from Dog Venture. Yeah, Dog Venture HQ, Dog Venture Clinic, Dr. Ammarah, compassionate veterinarian with over 15 years of experience, who specializes in internal medicine, is a renowned veterinarian joining us to discuss all things cat and dog health, from vaccine to emergencies, holistic care to skin issues. We have got it all covered. Stay tuned for answer to the most researched or searched questioned by pet parents. Cat and dog lovers, this is for you. Yes, I am Kasturi Jha, your host. Let's get started. Ask the vet everything pet parents need to know about cat and dog health. Welcome to Let's Off Leash, Amara. How are you?
I'm good, Kasturi. Thank you so much for inviting me to your podcast.
Thank you so much for coming. And how's the cat?
She's good. She is the boss of the house.
Yeah, that has to be.
Yes.
So, Amara, let's start with our feline friend, because as you already been experienced about the upbringing of your own cat, also they are n number of cat parents have so many questions about the daily routine, the daily life being with cats. So within that, we pulled a few very important questions which every cat parents should know to make their cats healthy.
Sure, I'm happy to help.
Like the first thing they are asking, or any pet parents ask, how to introduce their cat to their home.
So, there are two things that you have to know when while you are introducing a cat to your house. For the first few days, it's a new place. It is stress, and cats usually are very stressful. They get stress out of very, very small things that you can't even imagine. So, first of all, if you have kids at home, don't get it as a toy. Don't let them play with as a toy. Give her own space. Let her smell around your house, go around and explore your house, and give her a proper space for her litter box and her food. If this is one scenario where you have only one cat, you are getting your cat. But if you have a multi cat household, then the whole scene changes. Okay. Usually we think that, okay, like humans, we bond over food, but it's not like cats. Cats, in nature, they fight for the food. if you get your cat and let her feed with your other cat, then there will be competition. They will think that they're competing for something, that you got a competitor, and they will never be friends. So you need to have a slow transition. Like you need let one cat in a cage, the other cat let her smell around it, get some, something to calm down the cat, and then you can introduce them slowly. So the first thing that you have to do and always have to do is to make the new cat comfortable. Let her be comfortable. Don't go in with the cuddles. I'm sure that when you get the new pet, you want to cuddle them, you want to give them all the toys, all the treats and everything. No, first let them be comfortable. And the first and the most important thing is to get a vet checkup. That's really important because the vet will actually counsel you how to, what food to give, how's your cat, is there any problem, are there any viral infections, so that you don't have problems in the future and the cat has a happy life.
Amazing. Yeah. So another very common questions they happens to ask that what vaccination does my cat need?
So, if you have a cat which is a kitten, when you get a kitten, so they need core vaccinations. The core vaccinations is a 3-in-1 vaccination which will help with panleukopenia, which will help with rhinotracheatis, and which will help with the herpes virus and calcivirus. So those vaccination plus the rabies. But when you get a kitten, it already has antibodies from the mother. So you need a booster shot. So at the age when you start at 8 weeks, you need first shot of the PCH, the for the 3-in-1 vaccination. And at 12 weeks, you need the rabies vaccination and the booster for the PCH that you already give. After that, every year, annually, you need vaccinations. That is only 2 shots, the PCH and the rabies.
Okay, that's it.
That's it. But this is the vaccination. But you have to give deworming, which is very important for the cats and dogs as well, and external parasite treatment. So mostly when I get, patients and this, they tell me, why do I need deworming? Because my cat doesn't go out. She's inside. Why do I need deworming? And why do I need external parasite treatment? The thing is, our cats don't go out, but we go out. We bring in our grocery bags, in our shoes, in different things. We bring worms that don't grow on us, but they grow on our cats. So every 3 months, we need to do the deworming and the external parasite treatment.
Mhm. Okay. That's actually very important because even they go for the work or does cat needs walk too?
The cats usually see the concept of walking a dog is to you go to do his business, for his urination, for stool and everything. So we take the dog out and he needs to take that. But cats are very agile. They jump all over the house and everything. So they don't need a walk, and they use litter box for their business. So I don't think cats need a walk. But yes, if you have, because I don't like the concept of putting a cat on a leash. That's not something you really do. Okay, so if you at home provide the environment or a room or place where she can explore, where she can scratch on a scratch tree, where she has shelves to jump on, that should be enough.
But there is a trick in this. Some of our audience has been asked that my cat is not using litter box. What is the reason? Is it because of UTI or something?
Yeah, there can be multiple reasons again for not using the litter box. First of all, is if the litter box is not clean. They will not use a litter box that is not cleaned. You need to clean your litter box every day. Another thing is if they cannot control their urine, okay? If they have some problems, they have infections, they have stones or something they cannot control, that's why they go out. The third thing is stress. So if you're not giving your cat attention, or you're getting another cat, or there are a lot of people inside the house, or you have changed the houses, to get the attention, they will go and pee on your bed. They'll go and pee on your carpet. So that, when you talk to them, why you obviously, if somebody pees on my carpet, I'll tell them, why are you doing that? So when you talk to them, they don't know that you're talking. They think you're giving them attention. Okay? So these are some things that you have to. And also sometimes when you change the litter, sometimes they have one kind of sand and it's not available in the pet shop. So you get another kind of sand. That's also sometimes they don't use the litter box. Some some of the times can also be that they need a covered litter box.
Okay, that's
Yeah.
for their like a
Yes, for their
separate way
privacy. Yeah,
privacy. Okay.
they will need a covered letterbox. So these are cats, actually, they're very mysterious, they are very unpredictable, and they are very clean. So if they are not using the litter box and they are not grooming themselves, there's definitely something wrong.
And that time we have to run to vet.
Yes,
Don't wait for until that.
yes, you don't have to go on to, because
Because being a pet parents, I think you have to be very cautious and very careful about their body language because they can't speak. We have to judge by that only.
they have their sign, they're very good at hiding their disease. Signs are very subtle. For example, your cat is drinking a lot of water, it can be a sign of kidney disease. And you will come to a vet when she's not eating, she's not vomiting, she's vomiting, she's having bad breath or something. That time you'll come to the vet, and that will be a second or third stage of the kidney disease. The first stage is a very subtle sign that the cat's coat is poor and she's drinking a lot of water. So that's a sign you have to come. So these are very subtle signs that you have to see.
And how pet parents, like cat parents or mean dog parents, how they get up to date by all these things, how they get to know more research or talk to their veterinary regular basis, like get in touch with your vet.
Yeah, see, vets are not only for diseases. Yeah, you don't have to go to the vet only for vaccination or a disease. When you come for a consultation, you have to ask your vet questions about the daily things. We have been studying, and there is research every day, new research in veterinary field, not just about the medications but also the behavioral science. Like, I have done recently a course for cat behavior. Just it I was very curious because I have a cat, and I have patients as cats, because uh, just f- it's not just about disease. Okay, you have a treat it as a case, treat it as a disease. It's not like that. They have feelings, they have emotions, which actually affect their health, same as us. We talk a lot about human mental health. There are a lot of days for human mental health day and everything, but nobody talks about the mental health of pets. It's very important. And also regular checkups. You have, like, for me, if I will take my son to a regular checkup. Every year I will have a regular checkup. I'll think, oh, I didn't do a regular check. I didn't do a blood check for him. We have to do the same for this one, so that we don't reach a point where we have to hospitalize our pet. We don't reach a point where we have to do major procedures for that. We have a baseline for the health. We do it with food, supplements. The only thing that you have to do is go and talk to your vet about it. That's it. There's nothing, no more science. Leave it to the vet to counsel you regarding that, but ask questions. That's very important.
Amazing. There is a very common thing, or maybe come in later stage, like with especially with the feline friends, like the dry FIP. It's very like, what's the treatment for that?
So, the dry FIP is actually a form, it's a bad form I can see from corona. 70 to 80% of Dubai cats, if you check for corona, they have corona. This is mostly in multi-cat households and everything. Now people are becoming more aware about corona because humans got corona. Before that, they were not like, corona. Now they're, oh, what's happening with the corona? So it's actually sleeping. The corona is something that's sleeping there, it's not affecting. But once the immune system gets a hit, once there is a stress, mostly in multi-cat households, it transforms into FIP, feline infectious peritonitis. It has two forms, actually three: dry form and wet form, but the dry form also has a neurological So there can be blindness, there can be seizures, the cat can be zooming around and this. So for both FIPs, there are research going on different type of medications, different type of injectables, which usually are not FDA approved, but we sometimes use it as like a research going on. And 70% of cats do recover from that. The problem with dry FIP is it's very hard to diagnose because you don't get the signs very early.
In which symptoms are not early.
Yeah. In wet FIP, you see that there is some kind of the cat, there's accumulation of fluid, the cat is feeling like that. But in dry FIP, the signs you get are sometimes you think, okay, it's only fever. Maybe it's not FIP. It's only diarrhea. Maybe it's not FIP. It's only sneezing. By the time you get to the point of diagnosing that it is FIP, it's too late. So that's the problem with dry FIP. So if at when you get a kitten and you go to your vet and you get this panel FIV, FELV, and Corona done at the time when the cat is a kitten, when you get it, you have this baseline, the one I was talking before, that you should have a baseline. You have this baseline that your cat is Corona positive. Next time she has something like a fever or a diarrhea or persistent cough or some persistent sneezing or something, you tell your vet, my cat is Corona positive. The vet checks for FIP and you get an early treatment. When you don't know your cat has Corona, how will the vet know? So he will have to think about other symptoms first. Maybe it's just that, maybe it's just that, and then the it's delayed. Your care is delayed to the pet, and that is because we did not form a baseline for
And that's the difficult part.
this. That is something that I know everybody loves their pets, their kids. That is the devastating part when you know that you could have saved your cat, but you couldn't. It's too late. That's the devastating part. So, yeah.
Yeah, it's frequently hard. Have you heard from any of your patient like kind of lesson responsive, kind of what the resorptive, I think, feline. It's for the dental and something, because maybe the technical time, scientific term, I don't know. But cats used to have with their dental problem,
Yeah.
with something stuck in their gum.
Yeah, it is actually teeth resorption. So what happens is dental health is very important for cats and dogs because dental problems can also lead to kidney problems. This is something that we see. You have to start uh, taking care of the teeth at a very young age because when if you try to doing at like 6 months, they will not let you touch the teeth. So when they're kittens, what you do, you start with a soft, first your hands. Just massage the gums with the hands so they get used to this thing. Then get a soft towel and try to massage the teeth again so that they get used to the touch. Then a finger brush, and after that, a brush. Okay? So this thing, or tooth resorption, what happens is when they don't take care of the teeth. So the gum is infected, and then you need to do an extraction. If the extraction is not done properly, and if the when you do dental x-rays and the root of the tooth is damaged, you cannot take it out. So it remains there. Okay, and that causes inflammation which you can't do anything about. Even if you try to do the extraction, it doesn't come out. Sometimes it's successful, you come, but it's really really painful for the tooth resorption. So the thing to do about it is to take care of the teeth. Okay, if you see some viral infections in cats can cause dental inflammations, gingivitis, like that, infections, which even if you brush, you can't do anything about it. So you have to go for a particular regimen for the dental care with the vet. They will give you the antibiotics, the medicines which are needed, and the food that is needed for the teeth.
So many things involved in this. As I always say, pet parents have to be very, very, very careful and cautious about what going around with their pet.
Yes, so for that, you can't do, okay, today my cat is not grooming herself. Okay, maybe she's not in a mood. No, if she's not grooming herself, it's a problem. So you have to see the subtle signs. You have to know that they're very good at hiding diseases. So you have to see your cat will not tell you, oh, it's I'm hurting today, I'm hurting here. Oh, I didn't go to pee today. You have to be careful. Did she pee? How much? Another thing is, which I see very common, is that they feed ad lib. They give the food like that. They don't measure the food. Most of the people don't measure the food. Every food bag, if you check on the back, it's written for this age and this weight, how much food you have to give. Okay. So you have to give it accordingly. And you have to do like breakfast, lunch, and dinner. Not just keep the food there and let them. So if you just keep the food there, you will not know, has she eaten the food? Did she eat less food? Did she eat more food? What happened? If you don't change the water bowl, you will not know, is she drinking a lot of water? Is she not drinking water at all? What's happening? So all these it's a having a pet is a commitment. It's just like having a baby. Yeah, if you are not committed to it, please don't do it. What I want to suggest is, like, people go for training and everything, which is really, really good. But there should be a counseling before getting a pet. Somebody, like, if somebody wants to get a pet, don't go and get it as if you're going to the pet shop, as if you're going to a toy shop, getting a toy and gifting it to someone. Especially now it's Christmas and New Year, people usually do that. And think that it's a baby. You need to have counseling. You need to know, because it's not like, okay, now my son, my daughter, my wife, they are fed up of this. Let me rehome. Even if your intention is good to rehome and you give to your friend who you know that will take really good care. But imagine the emotional thing. Imagine you're giving your baby for adoption. Imagine the emotional attachment. So they get problems, they get stressed, their growth is not like that. So counseling, come to the vet, get a counseling, and get then think, do you really want this? But do you really want this commitment? If you are not ready, maybe in a year you are ready. Maybe now you know what I need to do. Maybe in a year you are ready and you can give a happy life to them, rather than giving emotional.
And this counseling or this discussion should be with entire family, even though for the maid, even though for the house help, even for everyone, that should be into the same page. We want it, we don't want it. This because we always say in Let's Off Leash, we are making this platform where I always ask them to come and watch, because we are very like hard truth we say that if you are taking a pet, it will be a burden, it will be a liability, because it will be a responsibility at least for 15 years, 15, 16 years. And in between that, you cannot decide. Suddenly, you cannot feel I'm allergic, I am planning for a baby, I'm going for a vacation, my parents are not allowing me, I am moving here. No. And most important thing, your account should have balance. You should be financially stable.
Yes, you need that
You
thing.
need
You
that,
need
because
that.
you cannot because you are not financially stable, you are not going to vet. You are not giving proper treatment. Because you cannot judge a treatment within, like, it can be 50 dirham, it can be 120 dirham, and it may be 12,000 dirham. Be prepared for that. If you are ready for that, go ahead. If not, why to take a burden in your life?
Yeah, why do you want to have a commitment?
Take extra responsibility. It's not necessary to have pet. You want to cuddle? There are so many cafes, so many shelter homes are there who allow them. Go cuddle there 1 hour, 2 hours, sit over there, play with them, come back home, you're free. But really, if you want to take some responsibility, then only go for it.
It is, as I say, it's like having a baby. If everybody in the house is not on the same page, don't have it. If you are not financially stable, don't have it. Then sometimes I also see that, if somebody is not financially stable and they are having a pet, and, they go to a vet, maybe they go for cheaper options, or they go for online treatment. Everybody is a Google doctor today. So they go online treatment and everything. Yeah, so it gets bad. from there. The thing that your vet could have solved, with a single consultation, you are coming to your vet. Like, people come to me with things which are like, okay, I read online on Reddit, I read online on this, that this is this. I don't know what to say. I don't want to make them feel bad that you did this to your baby, but it's really frustrating. Why will you do that?
But sometimes it's good to be blunt. I make sure that when I see all this thing, no, I am very rude about this because it's about a living being.
And the living being who cannot speak, so they need somebody to speak for them. So it's like, poor souls, they're getting abandoned. I have seen, people coming to me with a perfectly healthy dog, and I want to euthanize the dog. Why do you want to euthanize that dog? Because he's barking a lot. And that dog, I said, okay, let me keep it in my hospital for 12 hours. I want to see what kind of barking is it. And trust me, Kasturi, he didn't bark at all. You know the
It's
prob
the
what the
environment.
problem the no, the problem was, he got that puppy thinking it's a golden retriever. And he didn't turn out to be a golden retriever. And he wanted to get rid of the dog. Just because of that, like,
The breed concern.
just because of that. So what does it tell you, that people are getting pets as a status symbol?
Yeah, yeah, absolutely.
It's not like you're getting a car or you're getting a, house. It's a human. It's not a human. It may be better than a human. Yeah, it's a living being you're getting. So that I couldn't. I told him no. I'm lucky to work with people who are also passionate about. So they were like, okay, let's keep him. Maybe somebody else will adopt him. But I said, I will never euthanize. Why will I euthanize a perfectly fine, just because he's not a golden retriever?
And don't you think that there should be some strict laws and there should be some bond signing?
Yeah, I think that's what I'm saying. That before getting a pet, you have to maybe sign a bond, or sign, something that for 1 year I have to take care, and what there should be some kind of regulation. And you have to go, one thing that is really good is to go and adopt from a shelter. Only people who, love animals actually adopt. That will make this. We have so many shelters, flooding with pets. So if everybody adopts rather than buying, it's amazing.
Yeah,
it's you know
demand
it's amazing.
supply. Always I say, if we don't demand, supply will be less. So before blaming the breeders, we as a human individual have to take the responsibility that there should be no concern about which breed, how much bigger paw, how much bigger coat, how long it's like, how shiny is it.
Yep. Yeah, how cute it looks, how this cat is that, the dog is that. Yeah.
Real life thing, real life experience. You need to live with them.
Yes. Like, for example, in our clinic in Dog Venture, we have almost 100, dogs every day. And, like, I see the staff, how they take care of it, how they play. Even if they are not required to do things, they do that. They check them for anything, like, they call me, Doc, can you please see? There is something wrong here. He's not walking properly. And the things that maybe the owners, because they are busy or this, they couldn't see, our caretakers, our day boarding team, our the people in our dog hotel, they see it because they care, and they see,
Because they're
they
seeing longer than the parents, I
yeah,
think.
they
Yeah.
pick up the signs, and we are able to, we are really able to help them at a stage where it's helpful for them, where it's, the first stage, and they don't have to do something. So compassion is something that those people, they have compassion. When we see that we have compassion, no, it's really, really important. If you have a pet, compassion is important.
Important, very
Yes.
important. What is the nasal discharge for cats mean?
Okay. There are respiratory problems in cats. It's just like common cold in humans. Okay, mostly they have the upper respiratory tract diseases. So they will sneeze. There are discharges which are just because of allergy. There is no color in the discharge. It's like the normal discharge. So it's common. It's because of the allergy. Maybe you used a different perfume. Maybe you used a different floor cleaner or something. So that's why it is there. But if you see that it is continuous discharge, it's not helping at all. It's not going by its own. There is eye discharge, there is lethargy, and the discharge changes color, like it becomes greenish or yellowish, then it's a problem. If it's one or two times you see a little bit of discharge, it's okay, it's allergy. But if it's consistent, you need to go, because it can, they usually eat food because they smell the food. If they can't smell the food, they will not eat food. So yes, so they will not eat food, and then there will be anorexia. Like they will stop eating and everything. So yeah, it's something which you should be concerned about, but it has stages.
We have seen that many cats or many pets, they got that skin allergies, skin diseases.
Yeah.
What's the core reason for this and how bad it can go?
See, the skin diseases which we mostly see here are in dogs, and there are different reasons for that. The most common that I see, which we usually ignore, we go for, maybe it is that, maybe it is this. We walk our dogs outside on grassy areas. Okay, mostly we prefer grassy areas. And there are pesticides, and the water is treated that goes to the dog. What the dog does, they go home and they usually scratch around here, around there. That pesticide gets attached to the body and it causes allergies. If you see most of the dogs, they have allergies over their abdomen, they have allergies around the areas which are accessible to their paws. So that can be a major reason, which we usually think, no, it's not that. Maybe it's something that, why is, oh, there is a big rash. Why is that? If we just, when we go home, wash the paws, clean the paws, that can be the first thing that you can do for that one. Clean the paws, but make sure you dry it. After cleaning, dry the paws, you will see a huge difference. Also, the products that we are using at home for cleaning, they should be pet safe. Dettol is toxic to them. Don't use Dettol at all.
Dettol is toxic
Yeah.
for animals?
Yes, don't use Dettol for them. So just use maybe Clorox. Maybe there are F10, safe for you. There are a lot of things that are naturally good for the pets, like they are pet safe. Use those things. Okay. Another thing is the food. The food allergy is very, very common.
It's both for feline and dog.
Yes, the food allergies are very common. Like you change the food. Sometimes what we do is, okay, we are getting one food, and then tomorrow, because this is finished, let me get another food. Maybe he's not eating this food. This is chicken flavor. Let me get turkey flavor. Or we get treats. You know, you go to a pet shop, you take two, three. Okay, let me take salmon. Let me take turkey. Let me take this one. So what you're doing is, see, protein is the main ingredient of a food. So they are allergic to protein. So if you're changing the protein frequently, you will not know what protein they are allergic to, and they get allergies. The allergies can either be, the skin allergies when they start itching, or it can be for the tummy, they can have diarrhea, they can have this. So that is also sometimes, which is that we have to, the pet parents have to be very what I can say, patient with it. Like in humans, dermatology, human skin conditions take a lot of time to heal. It's same with the pets, and we have to do like we have to give them time to change. Like, okay, try this, try a food which is hypoallergenic, try this one. Because what we can do is, okay, you come to me, your pet is itching, I will give you a steroid, your pet will stop itching. But what did I do there? I made you happy because your pet is not scratching, but I didn't go to the deep dive. I didn't go there. What is the cause? What is causing it? Because once you stop the steroid, either you have to keep him the whole life on steroid, which is very bad for them. Or when you stop the steroid, you will come back to me. He's itching again. So we have to go to the root cause of it. Okay, it can be normal bacterial infection, fungal infection, or it can be allergies or environmental allergies or food allergies, where we have to take our time to describe it, to see what he's allergic to, this thing. Which I usually see some parents, they're very, very good, they're compliant, they want to know about it, they have patience. But some of them, they just, when the dog is itching, no, 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 I want the itch to stop. Okay, I don't want to give you steroid. I don't want him to, I don't want your dog to have steroid. No, give me something the dog. Okay, let's do this. Oh, no, no, I'll go to another vet. Another vet, maybe he will give you steroid. So, oh, see, he's a very good vet because itch stop. No, the itch will come back. But what you're doing with the steroids, it is immunosuppressant. So what you're doing is why you're getting allergy is because something is coming to the body and your body is fighting for it. Your immune system is good. Allergies are only in patients and even in humans where you have a good immune system, because your body is fighting, you're getting allergy. So what you're doing with the steroid is you're asking your body not to fight, so you don't get allergies. So you're suppressing your immune system, which is not good for you at the end. So do try to be compliant with what the vet is asking you to do. Okay, it might be frustrating, I understand. Skin problems are frustrating, it can be, but what you're gaining, you have to see what you're gaining and what you're losing at the end. Another thing for cats, usually dogs do have fungal infections, but mostly cats, ringworm, they have the fungal infections, which can go to humans as well. It is a long, there is treatment, but it is maybe a 3 week to 5 week treatment. But as long as you're compliant, the cat will be fine.
So, at the end, can we tell that medicating or over medicine can affect feline?
Of course, both felines and canines. You don't have to medicate them, but I am an internal medicine specialist and I don't go directly with medicines. It's my specialty, but I will still not go directly with medicines. I will start with the basic, with the small thing, with the basic. For example, if there's itching, I will maybe give you citrazine, which is the basic thing. I will not go directly to the steroid. If you have diarrhea, I will maybe start with probiotic. I will not directly go to your antibacterial. Why do you want to give antibacterial when it's not needed? Okay, if you want to be happy and you want a quick solution, okay. But what about when he will have another more, this time he doesn't have bacteria, but just to be sure, just to give him medication, you're giving him antibacterial. Okay, now he has a resistance. Next time you give the antibiotic, it will not affect, and that time you will actually need the antibiotic. So don't over medicate, start with the basic. And really, if you have a baseline of your pet's health with a simple blood check every year, you would not have many vet visits for this thing. You will just give supplements and a good food and everything will be okay. So I think having a basic line, like a baseline for your pet's health, is really important.
Absolutely amazing with the feline cats. Now, this is the time for the deep conversation about my interest too, as a canine mother, a dog mother. So, first thing about dog, a very very curious and very heartwarming thing for me to know, does Parvo have any treatment?
Parvo has a treatment. So, first of all, you have vaccinations, right? If you are up to date on vaccinations, I'm not saying that if you vaccinate your dog, he will never get Parvo. No, he will get Parvo, but he will survive. Okay, it's not a complete protection. He may or may not get Parvo, but if you have not vaccinated, he will get Parvo and may not survive.
So it's about every year process, Parvo.
Yes, it's the annual. Yeah, it's the annual vaccination. Every year you give, and usually I have seen people saying, "No, my dog is old now. He doesn't need parvo. He doesn't need vaccinations." But you're forgetting that when they get old, their immune system also weakens. Okay, that time they need more protection, right? So they can get. I have seen 8-year-old dogs, 9-year-old dogs getting parvo. So, because why the parents stopped the vaccination? Vaccinations are these are very small things. You don't need to go to a very high level of science to understand this. That just small things. If you follow, it will be great.
Okay, so there is a very common questions in for many pet parents, especially for dogs. How often should I bath my dog?
Every 15 days.
Every 15 days for every coating dog.
Yes, every 15 days. In winters, you can make it 20 to 25 days, but every 15 days you should, yeah, bath the dog. But if they have skin conditions, if they have problems, then you have to go according to your doctor's whatever they say, doctor's prescription, the same shampoo, the same how many times they ask you, that you have to do. But normally 15 days is okay.
And what will be the best treatment for ticks, flea, or any skin condition?
For ticks and fleas, as I said, the external parasite treatment, there is Bravecto, there are so many options, NexGard, there is a lot of options that you can give for them. And nowadays, there are pills which are deworming and external parasite together. So, if your pet is fussy and doesn't want to take tablets, those are very tasty and chewable tablets. You can give that one. So, it's not something that you have to go out of your way to do. You're giving deworming every 3 months, give external parasite every 3 months. So that's the best thing, that because usually you think that it's only the external parasites, it's only the ticks and fleas, and it's only causing itching, but they can cause blood parasites. Okay, there is heartworm, there is babesia, there are a lot of blood parasites that can happen. Ehrlichia, I have seen recently a case of Ehrlichia in dog. So that's because of the ticks and fleas on the body. They cause blood parasites, which can cause these disease, and these diseases are fatal. It's not just up to the skin. So it goes to your blood and it's fatal. So it's important. Just like vaccinations are important, this treatment is important too.
Right.
Yes.
Uh, Suddenly, you see your dog is limping. Is this a very serious reason behind it, or is just a pain?
See, um, limping, if you come to me or you call me that my dog is limping, my question will be, first of all, did something hit him? Did he fall from somewhere? Check his paw. Is there something hurting in the paw? Check the nails. Sometimes the nails are long and they are inside, and they are hurting him. This is the physical checkup, okay? I will also do the physical checkup. Or if there is like the dog fell from the lap or something, then it's something we have to check to do an x-ray. Then there comes the breeds like labs and golden retrievers. They have hip dysplasia. So always when there is a limping, maybe he limps for some time, like 1 hour, 2 hours, and then he's okay. It's fine. You can leave it. Or you see some physical thing like he got hurt or something, you know the reason. But if it's a persistent one, you need to go to the vet. They will check and they will do x-rays if needed, and they will tell you it can be just a cramp where they will just give anti-inflammatory or something, or it can be something serious. It can be even a fracture which you don't know. Maybe sometimes our dog is walking, running, and we don't know. So it can be that also. So also, here I will talk about the supplements. Once your dog, especially golden retrievers, big breeds, labs, once they are of a certain age, 3, 4 years, give them joint supplements. Start doing. Don't give a joint supplement when you see your dog is limping. Start before, because your dog is limping, he needs medication, not a supplement. The supplement will just help, but the damage is already done. If you know that, okay, I have this breed, that's why I'm saying counseling is really important before getting the breed, so you know how to take care of it. Yeah, so the you will get like a guide, the whole guide of how to take care and what to look for in this breed. So you start before, and then there are very less problems. Yeah, then you have very less problems to face in the future. That helps you financially as well, rather than your cat or your dog having a disease which could have solved because of food or supplement, you need to go and hospitalize the dog or your cat. It helps you financially also, that you are ready. This breed has this thing. I have to do this. My doctor has said that. So do a counseling before getting a pet. It's good for you and it's good for the pet as well.
Absolutely, I agree with this. There is nowadays we can see there is a common disease going on through every, like most of the dogs. It's a cherry eye problem. What is it like? How does it occurs?
It's like a gland, okay, that pops up, it inflames and it pops up outside the eye. So what happens is, the dogs, if they have conjunctivitis or an infection in the eye, sometimes we see, oh, it's a little bit, it's nothing, I will just wipe it, or it's a normal discharge. And this, what happens is, the dog tries to scratch, or the area here inflames. It inflames and the gland comes out. That's the cherry eye. That's the inflammation. The gland is always there. It's not something that just popped out. It pops out because of inflammation and infection. So then, if same thing, if you have gone earlier, if you have checked it earlier, maybe the vet just gives some drops and the inflammation goes less and there is no infection, no scratching, nothing. But when it actually becomes like a cherry and this, then we have to do surgery for that one, because otherwise it will affect the cornea. It will cause ulcers.
It can go that much wrong.
Yes, and it can cause, like, it's like a curtain on the eye. So you have to, it's something big. You have to take. It's irritating. The dog will scratch. It can scratch the cornea and it can become an ulcer. So you have to take it out for that one. So
Early treatment is very
early
important.
detection, early treatment, very important.
There is like I wanted to know the risk of pyometra or mammary tumor. It has been significantly seen that the old dogs or most of the dogs above 7 years are getting this disease quickly.
Yeah, because they have not been spayed before. If they spay, what is pyometra? Pyometra is pus in the uterus. So there is infection. If you are not uh, spaying your dogs, it will happen sooner or later. See, for me, I usually go, you can do from 6 months, 6 months of age, anytime you can do it. For me, I will go after 1 year. I usually give them time to have their first cycle, have their first period, like that, have their that one, and have the hormones are balanced in the body. So after 1 year, they already have their cycle, just spay them. If you're not going to have, if you want to have one babies, like you want to have them, okay, go ahead, but not for breeders. Don't overbreed them or something, but have babies if you want. But just don't do, okay, no, I don't want to spay. Why will I spay? It's not natural. Usually some people say, it's not natural, it's not something, but at the end you're harming your pet. So then at the end we have to do, and there will be pyometra, we have to open and take it out. So why not do it before, rather than sometimes pyometras, there is an open pyometra and closed pyometra. Open pyometra, you can actually see there is like pus coming out and you can detect, okay, yeah. Closed pyometra, you can't even see and it can be lethal. The patient can pass away because you don't have any symptoms. It's closed, you don't see any pus. So it's really important to get them spayed. Yeah,
That's that's dangerous.
it's dangerous. Pyometra is dangerous.
Okay, so emergencies can be really terrifying. And it's better that pet parents should know it before that they don't have any answers. So we call it like emergencies 101. Rush to doctor, rush to vet. Why these situations come to any pet parent's life? Why not before they can judge what is going on?
See, usually in emergencies, you need to have, as I told you, a research about what is an emergency and what is not an emergency. Having an itch is not an emergency. But if the same allergy can be life threatening and call like, it can cause asphyxiation, like, the allergy will cause swelling, everywhere on the windpipe also, and your pet can, it can be fatal to the pet. So you have to know the difference between the two. What is my pet allergic to, what is not, what plants are toxic to my pets. Okay, it's very hot, my pet can be in a heat stroke. Yeah, so all these things you need to do. You need to have a research about it. You need to know that my pet, okay, I have a cat, I can't have lilies in the house. Even the water from the lilies, it's toxic. It's like immediate toxicity. Chocolates, you can't have raisins, things like that. It's small, small things. We have cases where the pet has eaten a socks and they don't know. Yeah, socks, and they don't know. So sometimes they know and they said, okay, he will vomit it out. And sometimes it doesn't, and it causes a lot of problem. So there you have to see that, okay, this is a emergency, and how you can avoid an emergency is to be really, really, to be fast enough to respond it, and not to have it to a degree where it can turn fatal. So just know about the things which can cause emergency. Yeah. It's all about knowledge.
Yeah.
Yeah.
We want to let our all the pet parents know what is the sign of life threatening for a dog.
So, life threatening, first of all, you have to see that the airway is clear. Okay, that can be life threatening. If the dog is choking, if he's not breathing, okay, that is life threatening. An allergy, like I told, that can cause choking, that you see that all of a sudden the dog is swollen, the face is swollen. This can cause like swelling of the windpipe, and it can be like life threatening. Eating a chocolate in a large quantity, mostly dark chocolate, eating raisins, okay, alcohol. Sometimes you will put alcohol and they will drink. That is, toxic. And some common emergencies which are like, very common sense, like there's a lot of bleeding, like there is this, that can be very harmful. Another thing, usually, which is an emergency and has to be like to be with the doctor, is called gastric dilatation volvulus, GDV. It's like bloat. So what happens? It happens mostly in big dogs. They're eating fast, and what happens is they are playing after eating. So what happens? The stomach twists. Okay, when the stomach twists, there's no blood flow. There is lot of gas, and there can be death within 30 minutes, even without that one. If you see that he's vomiting and there is like a bloat, there's a lot of gas, and immediately to the doctor. Immediately. You don't have to think twice about that, especially with big dogs. It's very, very important.
Okay, so there is a real life case. I got many messages from many pet parents, be it for the knowledge or be it for the concern or be it for the injustice they went through. So, one case I remember recently I dealt with, and it's very disturbing for me. She messaged me because she already lost a puppy. It's 45 days old, toy poodle, and the poodle was sneezing a lot, like a simple cold and cough point of their thinking. So they went for vaccinations and all, and they get some shots, I believe, from the doctor, from the vet, and they came back home. Once they are home, they found that the dog is not as active as it happens to be before, and not having food, it's not been cured. So they again went to the vet, like after 2 to 3 days. Vet given some IV drip and some shots. I do not know why it happens, but in front of their eyes, the dog was attacked by seizure and stopped breathing. So the concern is, do the vet can did it better way, or they can refer it beforehand only before the baby passed away?
See, what happens is at 45 days, there is a viral disease called distemper. That, as you said, there was a seizure. So it is a neurological disease. Okay. Before doing any vaccinations, we usually test the dogs first because what we are doing is the vaccine that we are giving is like a what inactive virus. If the why we do the test before is if the puppy already has the virus and we are again giving him the virus, so it will get activated more. Okay, and it can be fatal. So if he was sneezing and if he was having like this and he has a seizure and everything, maybe he had distemper. So before doing the vaccinations, if you check for all the viral diseases, it can be a baseline for whether we have to do this vaccination or whether we have to cure this disease first. Okay. And also, since if it's a toy poodle, maybe he was with a lot of other dogs when they got him. Okay. First of all, what is happening these days is they should have their mother's milk for at least 2 months. What is happening is I see 1 month old puppy with them. So they don't have enough immunity, first of all. Then they are with a lot of other dogs. The immunity is already compromised. You can get kennel cough, you can get distemper, you can get parvo, distemper, all of these are very, they're very fatal diseases. Why do you want some a puppy to suffer because of that? So I think the same has happened to him. He might have been taken from the mother earlier. The immunity is very low, and then maybe he has distemper, was not tested for distemper, given the vaccinations. The poor body could not, you know,
Take it. Yeah, I have those videos. I have seen that what that poor baby went through. So, do you think I respect all the like what the vets are doing from core from my heart, but sudden time, do you think vets can judge properly, diagnose properly, and for them, uh, the other side have to die?
no, see, the thing is, as vets, we also have an oath for us, a veterinarian oath. Our first priority, we will give it our everything to save this thing, is to save the patient on our hand. You can't imagine that, if we have a patient in the hospital, for example, I can't sleep at night. I will call 100 times. If it's an emergency, I'll call 100 times my nurse or something. How is it happening? What's happening? Like that. I'm sure whoever that was, my colleague, would not have done anything deliberately. He will not do it. There are some cases where because of a lot of things you don't have time to even think. You first thing what you do in an emergency always is try to save the life, then go for the reason because it's an emergency. He put an IV to save the life, to make him stabilize first, and then he would have thought of doing what we will do next, right? But the poor soul couldn't take it. He couldn't take the infection. Maybe the infection was already spread a lot. He couldn't take it, and his immunity was not good. That's why he was.
It's not. It might be lack of knowledge.
No, lack of knowledge. It won't be lack of knowledge. It might be not lack of knowledge of the vet. Okay, it might be starting from the point of the breeder. It might be starting from there. It's from the root because you are producing a baby and after 4 weeks you're taking it from the mom. So first, that time you're not actually, I don't know whether the mom is vaccinated or not. First of all, if the mom is not vaccinated, already you're giving viruses to the baby. Then you are taking it at 4 months, even 3 weeks, at 4 weeks, even 3 weeks, sometimes you're taking it away. So he doesn't have enough immunity in the body from the mother. Then you are putting him in a totally different environment with different things and this. So the immunity takes a toss. Then you vaccinate, but he already gets the virus. So there are a lot of things that are happening. And again, the parents went to the doctor at the end when he couldn't do much. it was not in his hands. He couldn't do much because 100%, even if I don't know which doctor it was, he still is my colleague. And I know, because we study really hard just to help them. Everybody who's a vet has studied veterinary with this thing, to help the people, and to help the souls that can't speak. So our first priority is to help them. So we will do everything in our, in our hands that we can do. It really affects us also when, a baby passes away and couldn't. It really affects us. Maybe we don't show it, and people think that maybe, we are going through this almost every day or thing, but it's really, really, depression in veterinary professionals is a real thing. So it's very, very common. So this is because we also feel this. So yeah, it's the root cause that we have to tackle.
And this is something very good point you have highlighted, that depression in veterinary, or I believe depression in medical field is very common, which actually people will say, oh, they are in the medical field and they only, but at the end, human.
We are humans also. We feel that, what else? Like, I'm 100% sure the doctor that you went to, he might have questioned himself 100 times, even though he did everything in his hand, but he might have questioned, what else could I have done, what else could I, and that leads to depression. It affects us also. Yeah, it's the guilt, it affects us, it does. And the parent is there, and they can cry, and they can do this. We can't even do that. We keep on questioning, so it's something that is really causing depression in veterinary field. Yeah.
So do you think that, like, why having client sign against medical advice form is important?
It's very important
Does
because,
a dog venture have?
yes, we have against medical advice forms, because
AMA.
yes, what we do is we suggest something for the good of your patient, for the good of your this. Maybe you think that it's expensive, or maybe you think it's not needed, or it's because of the money or anything, and then you take your pet out and the pet suffers. Okay, then you will come to us and tell us, why did my pet suffer, what happened to him? This is because you didn't agree to us. So we need to have that against medical advice form, so that we are in the clear. And you will sometimes, this is also a tactic that we use. When a person has to sign something, he thinks, no, it's serious. And it also motivates them to keep their pet there. Because even if you sometimes completely tell them everything, I don't know with what reason it is, they won't agree. Or maybe they will think that, from the pet's perspective, that maybe my pet is more comfortable at home. But right now, that time, our priority is not the comfort, our priority is the health. Sometimes, I will tell you, me as a mom for my son, if somebody will tell me no, if I don't know medically, and he will say, no, you have to keep him in the hospital. If I have the option to keep him at home, I will say, no, let me keep it at home. I will take better care of him. I can totally understand what pet parents can think, because they think maybe he's more comfortable at home. I can take much better. But that time you have to know that the vet is thinking about the health. We are thinking about the health of the pet. Comfort is okay, but we need him to be healthy, to be comfortable. That's why it's important to give them the form. At least maybe the form will motivate them, or at least we are in the clear, because sometimes humans misunderstandings occur. We don't want those kinds.
Bonding, yeah, and absolutely, I agree with you that AMA form is very important for all the hospitals, all the benches who we are boarding facilities, because you never know what's, yeah. Uh, have you, like, for your vast experience of 15 years, it's a long, l- tell me something which you will never forget, one of your patient, and you could have done something.
Yes, so there are things where I I'm very difficult person to do euthanasia. That is something, it's very, very, very difficult for me. It's tough. I can't, you know, I try my best to avoid it as much as I can, as much as I can. I don't want that to be my decision. But sometimes you have to make that decision when it's like, I had a cat, a Bengal cat. Was so they have genetic problems also, but it started with a small abscess. We treated the abscess, okay. Again, another abscess, again, another abscess. So many abscesses that the whole skin was open, you know. And the owner wanted to do euthanasia. I did not. I asked them to sign the form, but I did not do the euthanasia. But I tried my best to try and try, I think more than 3 or 4 weeks she was in the hospital with me. I even tried, fish skin. I got it all on my own expense. I tried fish skin to put it over, that thing to see if it heals. But it was a genetic condition and I couldn't do more. And because, I didn't want to do it. But then she was suffering and I had to end that suffering. That's something I'll never forget because I got really, really attached to that one. I was morning, evening, checking, cleaning, though my staff was like, Doctor, we will clean it for you. I was like, no, you don't. Maybe you will not know how to clean. You will not know how to clean. Let me clean. I was cleaning. I was doing laser therapy. I, I think researched everything that can be done. I did calls to my friends in America, Europe. Do you have anything that I can use? But at the end of the day, it was a genetic condition. Nothing could have been done for that one. So, yeah, that is something I'll never forget.
So it's an amazing trip of our this podcast journey. Every questions, every answers. I hope each pet parents get benefit out of it.
I hope so too. I'm always happy to help.
Our platform is honored by your every answer. Before we wrap up, there will be a tricky question that what do you think a veterinarian, a nutritionist, a healer, Reiki healer, what should be the POC first? And does they three go all along together?
I believe, and my principle is holistic treatment. I won't only go for a veterinarian. I will go for physiotherapist also, a Reiki healer, everything. It should all go together because our ambition, our aim is to heal, and whatever heals, I'm with that. All three of them together. Yes, you need maybe a diagnosis from a veterinarian, and the veterinarian will tell you that you need physiotherapy. Like in dog venture, we do physiotherapy, we do hydrotherapy, we do lasers, everything. And sometimes we use things which are herbal, herbal things and that thing. But the diagnosis should be from the veterinarian. Then for the treatment, you can use a holistic approach. You can use Ayurveda, you can use Reiki, you can use everything which is beneficial for the pet. But diagnosis from the veterinarian. Don't self diagnose. Don't do diagnosis from Google or
Oh,
ChatGPT or
chat GPT.
Quora. Don't do that from this one. Do your diagnosis, go
AI
to a
is
vet for
going
the
faster.
diagnosis. Yeah. Do your diagnosis from the veterinarian and then you can go for everything.
So whole purpose is to save life.
Yes, that is the purpose. That anything, anywhere, even I have to go to a magician to save a life, I will do that. But go to the veterinarian first to save, to get a diagnosis and to know what to do forward.
Thank you so much for your valuable time. And if you want to meet directly Amara, Dr. Amara is amazing and helpful. If you want to have any visit to Amara, it's not necessary that your pet is seriously ill. It's good to concern before it gets serious illness. Dog Venture is the place where Dr. Amara is always available.
Yes.
Take appointment. All the details linked below. We will give it in the below. Let me know which feline or canine parent are you in the comment section. Amara, how did you like Let's off leash.
Yeah, it's amazing, and you're doing a great job, Kasturi, by having awareness, spreading awareness about this, because awareness is where the treatment starts. So, yeah,
It's a wrap. Thank you so
thank you
much.
so much. Thank you.
Thank you so much for tuning until this. Dr. Amara for sharing such valuable insights today. To all our listeners, remember that pets rely on you to keep them healthy and happy. We have to be really very careful. If you enjoyed this episode, if you enjoyed this episode, hit the like button, subscribe to our channel, and share it with all your fellow pet parents. See you next time on Let's Off Leash, where we unleash the truth about pet care. Until next time, keep the leash off and let your compassion lead the way. See you next time. Bye bye. Kasturi Jha.